Hello and welcome to the Let's Talk Thyroid podcast. I am Annabelle Bateman and I'm looking forward to diving into a really futuristic, in a sense, conversation today on the podcast with Dr. Joy Kong, all about stem cell therapy. Now, this is not a topic that probably has been covered very much in terms of thyroid health. And the conversation that I have with Dr. Kong is, whilst we've got some thyroid specific elements to the conversation, is a broader conversation about the benefits of stem cell therapy, where it's coming from, where it's going to in terms of its utilisation in healthcare. It's still all very new technology and not being widely used. So in a sense, this is a little bit of a futuristic conversation about where perhaps overall health management is going and how that might impact on thyroid health. So I hope you really enjoy the conversation with Dr. Kong. So Dr. Joy Kong is a UCLA trained triple board certified physician in the American Board of Psychiatry and Neurology, the American Board of Addiction Medicine, and the American Board of Anti-Aging and Regenerative Medicine. She is very highly qualified. She's the president of Uplift Longevity Center in Los Angeles, California, where she specializes in stem cell therapy, ketamine therapy, and as well a wide range of therapeutic modalities to enhance overall health and combat diseases with a holistic approach, especially by enhancing the body's own innate regenerative properties. Dr. Kong believes in advancing the field of stem cell therapy through education of both physicians and the public in general. She founded the American Academy of Integrative Cell Therapy, where she provides training to physicians on the science, clinical evidence, and safe protocols in stem cell therapy. She serves as a board member of American Association of Stem Cell Physicians and as a faculty member of a Medical Wellness Association, a leading global organisation on health and wellness. As a proponent for high-quality clinical research, Dr. Kong is committed to originating and conducting such research studies and is a published author in scientific journals. In addition, if there can be more, Dr. Kong is the founder and CEO of Chara Biologics, a company dedicated to providing cutting-edge regenerative medicine products in the United States and to the global market. She developed the most potent and comprehensive stem cell product in the country with a patent-pending formulation. Dr. Kong was recognised for her contribution to the field of regenerative medicine and awarded the Top Doctor of the Year in Stem Cell Therapy and Empowered Woman of the Year in 2019, as well as Stem Cell Doctor of the Decade in 2021 by the prestigious IAOTP, which is the International Association of Top Professionals. Dr. Kong's memoir, Tiger of Beijing, has garnered tremendous interest and was named 2020 Book of the Year from the IAOTP and showcased at Times Square. So after all of that, you can see that Dr. Kong is very qualified to be talking to us all about stem cell therapy and the future, perhaps. So today I would love to welcome you, Dr. Joy Kong, to the Let's Talk Thyroid podcast. We're going to have a really interesting conversation. So I'm really thrilled that you can be here today.
Thank you so much, Annabelle.
Yeah, so before we dive into talking about stem cell therapy, and I'm really looking forward to understanding a bit more about what that is and how it can relate to thyroid health, I'd just love it if you would tell our listeners a little bit more about who you are and what you do and how you kind of got into what into this fascinating part of medicine.
So I'm based in Los Angeles. So I'm board certified in 3 specialties. First in psychiatry, and then addiction medicine, and then I discovered anti-aging medicine, which I think is really the new way of practicing medicine, which is looking at all the potential causes that causes imbalance in the body. So we can correct a lot of things before disease manifests. But if we understand all these root causes, then even if the disease manifests, then we know how to correct it instead of just throwing medications at patients. So that's what, what I'm really passionate about. And I know this is a new way of doing medicine. It's just a matter of time. It's kind of a grassroots movement. So anyhow, I have been doing stem cell therapy for the last 5-6 years. It's very much connected to anti-aging medicine because anti-aging medicine, I think it's probably one discipline, or you can call it functional medicine. It's all very similar. It's a discipline that follows very closely what new research has shown, and then it starts to implement it right away instead of waiting for the entire juggernaut of this, mega mechanism of the practice of medicine to catch on. The usual practice of medicine is about 20 years behind what science has shown. So it just takes a long time to circulate into changes in practice. So then you got this whole group of doctors who are ready to implement. They see the scientific studies, they see the results, they say, okay, then let's move forward.
Let's go.
Recommendations. Yeah.
Wow.
So that's kind of what I've been doing. And stem cell therapy has become my passion because it's just such an incredibly elegant and revolutionary way of helping the body heal, because we are utilizing the intelligence that's in a cell. And of course, we're all made of cells, and we all started in life as a single cell. So the fertilized egg, that was the beginning of us. And from that egg, fertilized egg, we were able to form all these complex structures and starting to form organs and all these tissues. And, this whole 3D is like this magic making,
it's right? It's a miracle, isn't it? It's incredible.
Yeah. Exactly. And then we form a human. And so it's that kind of intelligence, because till this day, we can tell people how the embryo, how the embryo is forming, but we don't know why. We don't know why it's doing what it's doing. We can tell you exactly where things go, but we don't know how the cells know. So it's that kind of intelligence. So we are, as far as stem cell therapy these days, we're just borrowing a little piece of that intelligence. And it's revolutionary because this is the first time in human history that we're not using, a metal, a particular herb, substance or group of substances, which is our herbs. We're not using any of those. We're using DNA, because it's really through the DNA of the cells that they're able to respond and produce this vast array of signals to help the body heal and help the body regenerate. So that's why it's revolutionary.
Because you're using kind of part of the body to heal the body, as opposed to an external thing like a herb or a chemical. Is that what you mean?
Exactly.
Like a pharmaceutical.
Yeah. The cells already contain the intelligence that can make a whole human. So that kind of intelligence, if you can just use a little bit of it, it can be powerful.
Yeah. So is stem cell therapy then part of the broader anti-aging medicine? Is that
yeah,
understanding that right? You were saying that the anti-aging was the third of your board certified specialties, so you're an incredibly accomplished,
Thank you.
Very accomplished woman.
Regenerative medicine.
So the stem cell therapy is just part of that. Yeah. Okay.
Yeah, regenerative medicine encompasses everything that utilizes kind of the intelligence of the body. So PRP is one, which is platelet-rich plasma. You can get, spin the blood and you get a little portion, of the serum that contains a lot of platelets, which contains, platelets will secrete a lot of growth factors. So you can use that, or you can use different types of cells. And there are exosomes, which are what cells secrete.
I think it's just a little...
So you can use the exosomes directly, but the cells secrete a lot of signals besides exosomes. So anyhow, all these came from the intelligence of the cells. So that's regenerative medicine.
Yeah, wow. And as you said before, like it's a new and emerging part of medicine. It sounds like it's about as cutting edge in medicine as medicine goes. Is that right?
Yeah,
because you really
it's still new. It's still, we're still trying to figure out how to do this really, because the cells have, incredible potentials, and there's so many different kinds. How do you work with the cells because, in the past they had embryonic stem cells. So now it's still under research, but that's very controversial. That's why it was stopped for a length of time. So even nowadays, you can't use embryonic stem cells in the US to treat any conditions because, that's not, it's not legal. You can use it to do research. So that's allowed. But I think only for embryos that were already destroyed. The embryonic stem cell line, you can't destroy new embryos. So that's where things are at. So what happens is that when the embryo is forming, from the fertilized egg, in day 5 to 7 of this new formation, there's a little ball that formed. So inside the ball has what's called inner cell mass. So it has all these cells that have full potential to form any tissue. So what they're doing is to take one of those cells, and then you can form cell lines. So you keep the cell alive. So you're not destroying new embryos, but you can use those cells to do research.
Okay.
Yeah.
So you're taking a cell from the embryo, not destroying the embryo.
Well, you are kind of destroying it when you're taking it. Yeah. So the other types, you can either get it from your own body, which has advantages and disadvantages, or you can get it from birth tissue, which is what I personally, from my professional opinion, what I've looked upon, I think it's a really great compromise between embryonic stem cells, which is really powerful, but also can go wild. And then, and comparing that with stem cells from our own body, which are less powerful and a little bit more tired. And then also it can it can promote cancer formation more easily than the younger cells, because the older cells have lost certain intelligence. So anyhow, so there are all these cell types. Or you can, another cell type is what's called induced pluripotent stem cells. So they can take a stem cell, they can take any cell from your tissue. So like skin cell, fibroblast. So that's what that Japanese scientist did. He isolated the fibroblast and was able to induce that adult cell, fully formed functional cell, back into an embryonic state. And that allows full potential. But the problem is the same as embryonic stem cells, that they both types can go wild, can form what's called teratoma, which is uncontrolled cell growth. So that's a problem we haven't solved yet. Even though
and is that where perhaps some of the ethical issues come to?
The ethical issue comes from really destroying life. I think that is the part that's the most controversial. There are countries like Ukraine, they were doing fetal stem cells. So they're destroying a fetus. And that's, even more problematic because, they obtained a lot of their tissue from like women who go through abortion in Russia. So women, they get paid to get abortion, so then they would just get repeated. That's very problematic, right? So but if you use umbilical cord source, that's not there. You avoid all that problem because you only getting
I understand
the product, getting the tissue from life healthy births, and the tissue will be otherwise tossed into biological waste. But now we know we can harvest them and then utilize them. So there's no controversy in that sense. So ethical consideration is mostly related to life, whether or not we're destroying life.
Yeah. Okay. No, I think that's helpful to understand, because I think when we don't understand how all of this works, it's easy to make assumptions that maybe aren't true. So I think that was that's a helpful explanation. Yeah. So in terms of the connection maybe I'll step back. we'll come to the thyroid connection in a minute, but when we're talking about stem cell therapy, what does that really mean?
So there are different types of stem cells, but what's the most popular right now, scientifically, what's considered holy grail is what's called mesenchymal stem cells. So in short, MSCs. So these are cells actually are all over your body. So anywhere where you have blood vessel, your blood supply, that's where the cells are. They're kind of hovering over the blood vessels. They're holding on to the blood vessels, and they have all these, these feet to, either sense what's going on in the blood vessels. And they also have these, tentacles that can sense what's going on locally. So they have this ability to sense and to travel. So if they felt, or, certain signals that's coming through the blood, like an area, let's say your finger got cut, and then the cells are screaming, oh my God, I'm damaged, and, I'm inflamed, and all these, your immune cells are coming in. So a lot of signals are being emitted, and then the blood vessels will carry those signals right in the blood. And these cells in a remote site could sense that signal, and they could squeeze themselves into the blood vessels and kind of swim up to the site where the signal is the strongest. And once they get there, they can come out and come to start working. So they have many, many functions. Some of the main mechanisms of how they work is, one is that they're very anti-inflammatory. So they can calm the inflammation, because a lot of times what's going on is unremitting inflammation, right? So if we have inflammation that are just not reducing, that's why people are having these, chronic pain, chronic, joint issues. You just have this tissue are so inflamed. So if you don't calm the inflammation, then you really cannot mount the other side of the, the work of repair. So you can't. So you need to reduce the inflammation. That's what the cells can do. And the cells can also help your immune system to be more balanced. So they have a capability of modulating the immune system. If your immune system is weakened, these cells can help you kind of boost your immune system, strengthen them. But if your immune system is overactive, it's, going into these, autoimmune flared kind of state, then it will help the immune system to calm down. And these cells also have anti-fibrotic properties, which is really cool. Even for nodules, I've actually, there's one lady that I've given her stem cells. She has some thyroid nodules that she was following up with her primary care. And she would be doing ultrasound to track these nodules to make sure that, they don't change, they don't get too big. And she was tracking them. And then after one stem cell treatment, they couldn't find it. They're gone. So that's the anti-fibrotic property. Yeah. It can break down scar tissue. And I've seen that, in various locations, including typical fibrotic diseases like liver cirrhosis or COPD. These are all fibrotic diseases. And then I've treated a patient who had testicular repeated swelling, but also nodules, like marble-sized nodules. And then after stem cells, it went away. So anti-fibrotic properties, so very interesting. And it has ability to salvage cells. If cells are damaged in some way, and instead of dying, these mesenchymal stem cells have a way of communicating with the stem cells to stop them in their track. Instead of going on programmed cell death, it kind of, saves them so they can be preserved. An example is, let's say you have radiation damage, right? So certain cells are dead, but other cells are just damaged. They're hanging in there. They're about to die, but these cells can come in and tell them that they don't have to die. So,
and they can kind of clean them up, fix the cells to bring them,
yeah,
make them
they
healthier.
can fix the cells in many ways. One of the ways which, is so fascinating is mitochondria transfer. So a lot of cells are damaged. There's a lot of mitochondria dysfunction that can be happening in our body, right? Especially as we age. But a lot of disease have mitochondria dysfunction as a part of the mechanism. So these new cells are actually able to donate their healthy mitochondria to weakened or diseased cells and help raise their energy level and help their cellular function. So that's one way that they can revive cells, which is pretty fascinating. But it can secrete all kinds of other signals, right? Different growth factors and different cytokines to help change the environment and give the cell the right signal so they can, start to recuperate in a different direction instead of being stagnating in a sick state.
I hope you're really finding this an interesting conversation. I'm sure you are. I found it really interesting. I'm going to interrupt for a sec to tell you or remind you really about two things, because if you've been listening to the podcast for a while, you've probably heard me mention them. One is my brand new book, Kiss and Make Up with Your Thyroid, which is your guide to help you live a thyroid-friendly lifestyle so that you and your thyroid thrive. It is available via AnnabelleBateman.com or Amazon. Both as a paperback and as a ebook. And number two is my thyroid box, which is a collection of product to help you on your thyroid journey. So perfect if you're newly diagnosed or you've hit a bit of a slump or you just want to feel a bit of extra love, because there are some practical tools in the box, but also a few just beautiful goodies to make you feel special. But there's thought behind every single item that's in the box. So that is also available via my website and now with delivery to many countries around the world. So just check out the details on the website. All right, I'll let you get back to this really fascinating conversation.
And then these cells also have angiogenic properties, so they promote blood vessel formation. That is crucial in tissue health, right? So if we have, even if we can grow new tissue, which the stem cells can help promote, because they can talk to the local tissue-specific stem cells and tell them to regenerate. Because a lot of times, if we're sickened, or there are senescent cells sitting there, not really performing on any functions, but they can also spew out toxic signals that make the whole environment, inflammatory and toxic. So these cells are able, so the environment is not conducive to tissue-specific stem cells. So in our body, there are tissue-specific, liver has liver stem cell, your kidneys and kidney stem cells. So these are tissue-specific stem cells. But if the environment is not correct, then they just sit there and they don't produce new cells. But you also need to remove the bad cells, because if the bad cell is occupying the space, you don't really have a place to push the new cells. So there's this battle.
So you kind of clear out the bad to bring in the new.
So the stem cells are able to recruit immune system so they can help remove these senescent cells. That's part of the function of the immune system, right? The natural killer cells, and their various macrophages will come and neutrophil. So they will attack the cells that don't belong, that no longer serve its purpose. So you have to have the immune system function well enough to remove these cells, and then talk to the local stem cells, telling them, hey, make new tissue. And so but if you make new tissue, but you don't have blood supply, that doesn't work very well either, right? You want to enhance blood supply. So angiogenic potential, you can increase, the blood supply and the nutrient exchange and all that. And then it also has antimicrobial properties, which is very cool. Directly sending antimicrobial peptides that can attack, all these, bacteria, virus. So it's interesting. So that's kind of the range of functions it has. So it's a multitude of things they do.
I reckon. So does it work on a systemic level? So if I was to have a treatment, a stem cell treatment, it sounds like it has the potential to benefit me in all of those different ways, depending on what my body needs. Is that right? Or is it targeted to a specific area of the body or system, or is it systemic? It sort of just goes in and it does its thing everywhere and anywhere that it's needed.
Yeah, it definitely has a systemic effect. And what's interesting is, I just want to, make a disclaimer, I'm not making any claims. I mean, this is just
sure, absolutely.
In medicine. Yeah, because there's still the only FDA indication for stem cell therapy right now is umbilical cord blood derived stem cells used for blood disorders, either blood cancer or other kind of blood disorders. So that's the only FDA indication. Everything else is kind of off-label, experimental. So that said, just from my own experience and from the experience of other doctors who have been treating patients, when just my first patient is a perfect example. He was 70 years old, almost 70, 69. And he was told that he had to have bilateral knee replacement because they were just worn out. So 2 orthopedic surgeons told him absolutely he needed that. And then he came to me, wanted to save his knee. So I did give him knee injections, but I also wanted to help with the outer 1/3 of the knee, which is nourished by the blood supply. So I put some cells through, intravenous route. And what's interesting was, the knee took, a couple weeks to recover. But the next day he said, hey, I slept through the night and I haven't slept through the night for decades because I had rotator cuff injury. And every time when I shift in bed, the sharp pain wakes me up. So, but this is amazing. I slept through the night. And that's 6 years ago. So he's fine. His shoulder's fine now. And I never touched his shoulder. I didn't even know about the rotator cuff injury. And that, that answers you because of the intelligence. That's one of their mechanisms, the homing mechanism, right? They find the place where they're screaming signals and then they go to work in that place. So wherever that screams the loudest, probably will be one of the first.
And a rotator cuff can scream pretty loud. Yeah, okay. I think that's helpful to understand. Understand. And I think if I sort of think about it's interesting. I've had a lot of really interesting conversations on the show, and we have talked a bit about. You mentioned mitochondrial, the connection with the mitochondria earlier, and we've talked quite a bit with different doctors about the impact of or the connection between thyroid and mitochondria. So I can kind of see through a lot of what you've been saying, not just that aspect, but the systemic inflammation and, that balancing out of the immune system, some connections, potential connections. And I guess this is all still part of where it's new and experimental and who knows what might happen down the track.
Because
but the connection in with thyroid health.
Yeah, I get asked all the time, doctor, I have this condition. Can stem cell therapy help me? Of course, I'm not making any claims that I can treat this particular condition. What I tell them is that, well, let's see if this can help you by first looking at clinical studies to see if there's anyone that has done research on your particular condition. And then we can see if there's anything that supports that this can help you. But if there's no studies, then it comes to analyzing what is going on and how the disease is formed in the first place. So if we can look at the disease mechanism and look at the mechanisms of how the stem cells work, then we can find a way to see, okay, do they match? So if the stem cell can intercept in part of the mechanisms of how the disease is pushed forward, then you can help reverse the disease in some way, right? So if you have inflammations driving it, if there's, lack of blood flow, if there's immune dysregulation, if there's, scar tissue formation, there's a lagging in regeneration, in repairing the tissue. So a lot of these, if it fits, then yes, then potentially it may help you, may help your function.
Yeah. Yeah, I can definitely see how that has that potential to support, your body in that. And I mean, when I think about thyroid health, it's holistic. It's not just about the thyroid gland. It's not even just about the thyroid function. It's the whole body. So I think
Yeah.
what you're saying is that the stem cell therapy has the potential to support the whole body and then maybe directly or indirectly impact on different
Right.
systems within the body or different glands or,
Right.
organs.
And there are a
Yeah.
lot of different kinds of thyroid conditions. So depending on what kind of thyroid issue and what's causing that particular condition, then you can look at whether or not the stem cells, how they work will help that, the genesis of that condition. So if
Yeah.
there's autoimmune issues, then, the immune balancing effect can help it.
I was going to just ask, because you said before, the approach of seeing, well, are there any studies? Are there any studies in any kind of thyroid condition or, thyroid health with the stem cells?
I think there has not been enough clinical studies. There's some animal studies that has shown benefit of improved thyroid function, like in Hashimoto thyroiditis. So they have animal model that has shown benefit and shown improvement in function. So definitely, a lot of it we're still in infancy as far as stem cell therapy because we're using more broad strokes. So if we're using mesenchymal stem cells, we're using their capability of these, modulating capabilities, anti-inflammatory, anti-fibrotic. So these, they help that way. But some people may think of stem cell therapy as, my tissue's damaged. So if I put stem cells in there, the stem cells will form the new tissue cell, then my tissue is healed. We're not quite there yet. So there has been a lot of research that's going on, but that is going to take a while to be accepted. And because once you start to kind of manipulate the cells in a certain way, at least, you're introducing more variables. As far as safety. So there's going to be more regulation and you have to do a lot of clinical studies. So from theory to application is going to take a while. But in the meantime, mesenchymal stem cell therapy, which is not changing the cells too much. I mean, overseas, they expand the cells, but what I use in the clinic are original cells. So these are cells from the umbilical cord, and it's obtained through minimal manipulation. You're not using any chemicals or enzymes. You don't grow them. You just carefully separate them out from the tissue matrix, and you free them, and then you transplant that directly into the body. So that's considered tissue transplant. So you're introducing very little risk. But if you start to use different signals to seduce the cells to go a certain direction, then there's more unpredictability. And so it's going to be harder to get approval. So that's kind of where we're at.
Okay. And that's where I suppose you said right at the beginning, a lot of sort of exploration to those new frontiers of medicine often take 20 years to work their way through the medical system. Is that different?
There are a lot of very simple breakthroughs, including simple vitamins, how they can help the body help, fight certain conditions and, things that are very simple, hormone replacement. These are very, fairly straightforward, but it's still difficult to get doctors to embrace because they are practicing in this model of what they know. And it's very drug oriented. So if you're introducing something that's more natural and that's shown can be helpful, to embrace that, to break through that bubble of sickness, diagnosis, drugs, that cycle is very, very difficult. And it takes doctors who are more forward thinking to embrace this, new discoveries.
Okay. Yeah. So that applies in a broader range of
Yes.
applications, like you said. Yeah. Yeah.
Right.
But the
probably,
stem cell therapy fits within that.
Possibly it is going to take 20 years, if the way they're doing, if we're going to induce the cells to go a certain direction, it's probably going to take a long time, take a lot of money, because the drug trials are very expensive.
But in the meantime, you're able to apply that in a safe way because it's not so specific. Is that what you're saying? You're not manipulating the cell. You're putting umbilical cord stem cell like a transplant. I think you said that.
Yeah, it's a tissue
transplanting that into somebody else. Tissue transplant, right? Okay. And look, I think all of these sort of new medicine must be really fascinating. So, just to be on the cutting edge of that must be quite exciting, just on a personal, professional level. And I think to bringing it back to that, most of the people that listen to this show have a variety of thyroid conditions. Not all, but I'd say most. I mean, it's a thyroid podcast, so I'd say most people do. And like you said before, there is a range of thyroid conditions that people have. And what I've found is that a lot of the people that probably listen to this show, or you've, trying to manage a complex, thyroid is complex, it's whole body. We end up often doing lots of different experimenting, trying different things because we want to feel better. And the traditional medicine model is, to take synthetic thyroid hormones, which can help, but is not part of the whole picture. So I think often, those of us, maybe it's when you're a bit more desperate, you are prepared to try, new things. So I think that's really exciting to know that there is this option, and maybe into the future it will become more of an option, to try to support our overall health, and then potentially having some benefits for thyroid health. Is that like how you would see it might fit into my listeners that are a bit like me, I guess, have thyroid issues, trying to feel good and try different things? It's
definitely going to enhance your health. Even I tell people, even if, the stem cell therapy is not like a drug. If I didn't treat, I didn't get you to do better in this one area, not only you're going to get all these possibly side effects, but then there's just no benefit. But I feel that stem cell therapy, no matter what, is going to give you benefit, because it's shown in research that it has these anti-aging benefits, just an overall rejuvenating effect. They've tested animals after stem cell infusion, tested their muscles and their brain to look at different neurotransmitters, growth factors, inflammation markers, and everything had reverted back to the younger state. So a lot of the levels of what, all these molecules and all these metabolic activities of all these cells in your body has gotten younger. So that is, is an incredible benefit, right? And really aging is...
Yeah, completely. We're all want to be aging well, don't we?
and aging is really the prequel to disease. That's why we get all these chronic diseases, and aging is dysfunction. It's gradual dysfunction, losing healthy function of the body. So, and when the accumulation of these dysfunctions get to a certain point, then you get sick. So if you can reduce the dysfunctions, then you can prevent yourself from getting sick.
Yeah, which comes back to that root cause question, that you mentioned quite early on, is looking at the root cause. And yeah, with so many different, particularly autoimmune conditions, you look at all those root causes, and if you can prevent some of those things, then it's got to be good.
Exactly. Exactly.
Joy, is there any contraindication to someone accessing stem cell therapy I mean, I guess particularly with a thyroid condition, but even more broadly, like is there certain people or conditions that it shouldn't try it?
I think there are a couple. I used to feel that pre-existing cancer was a contraindication, but after a lot of research I've seen, it appears that early stem cells, like embryonic stem cells, what they do mostly is anti-cancer properties. So in a sense, it appears to be even protective. So I still advise people that there have been reports that people who have existing cancer, possibly the cancer could grow further. Although most of the evidence is really toward adult-derived stem cells, like from fat, our own fat, bone marrow, because our own stem cells are not as potent and are not as intelligent as younger stem cells. So I definitely think that's a higher risk, and that's one reason I don't do it, because I don't want to introduce risks like that. So that's something to, to keep in mind. And then the only other people who I've seen with side effects for stem cell therapy is people who tend to be very sensitive to a lot of things, including a lot of food, a lot of environmental, things that we encounter normally, that most people have no problem with, and they break out in a rash or medication. So these people are they're hypersensitive. So once in a great while, this is less than, probably 0.1% of my patients that that actually will break out with a rash from a stem cell treatment. But that's self-limiting, so that will go away, with some Benadryl, and the worst cases we'll get some steroid, but it's temporary. So those are the only things that I pay more attention to.
Okay. And if you were going to have a treatment, is it how is it? Is it intravenous? Is it like you mentioned before, the injection into the knee and intravenous? Like, what's the normal procedure? Or,
it really depends.
How is it delivered?
Yeah, it depends on whether or not we want a lot of local delivery, or do we want to bring in the immune system to help us heal. So when someone does intravenous route, then it does go into, first it go back to your heart and then lungs, and then it's pumped into your body, and it does interact with your spleen, your peripheral lymphoid system. So it helps your, recruiting the immune system to help your body. So really depending on what we're doing and what kind of tissue we're trying to get to, certain places, it's hard to inject. So it's better to have the injection delivered through the blood. So it really depends on the cases.
Okay. Yeah, so it can be both.
Yes.
And obviously that's, and how accessible is this therapy at the moment?
So it's definitely, I think there are a lot of doctors who are actually doing stem cell therapy, even though I think doctors feel a little bit exposed. They feel that the current atmosphere is not the most supportive, but they know how much is helping patients, and patients are asking for it. They want it because, I've seen so many just wonderful recoveries. Word spread. No one wants to suffer. So if there's a way to get better, they're going to find it. So that's what I'm seeing, even though, I think the number of doctors who are doing stem cells are still not as many, but definitely more. But the the number of patients who want it is more and more and more. And
so supply and demand, they might start offering it when the demand is higher. Yeah.
Yeah. Some still think that they have to go overseas to do this, but you can't do it in the US if you are not manipulating the cells, because that will be considered creating a drug. So if you start to use chemicals, or you start to expand the cells, which means growing them into huge numbers, the FDA considered that as making a drug. So the FDA requires clinical studies. So a lot of companies don't want to go through the high expense of conducting clinical studies. That's why they locate overseas. So somehow there's this idea that it's not legal in the US, which is not true. It is legal within certain parameters. So if you want to do pure tissue transplant, the FDA's idea of a pure tissue transplant is that you manipulate the cell minimally, and then whatever the cell's function was in the body before, it's the same function that you're counting on after you transplant it. And so that makes it tissue transplant.
Okay. So and you're saying that's what is legal, or what's not?
That's considered legal. The problem is that I think we're still at infancy, and as far as how to define, the uses and how the cells work, I don't think there's enough knowledge, and that poses a difficulty for the legislators. So certain rules may not be completely consistent with scientific understanding. So we're a little bit of mismatch. So I think it's very new, and that's one of the challenges.
Yeah. But it sounds like from what you were saying with the is it mesenchymal? Is that what?
Yeah,
is that the right?
Mesenchymal, yeah.
Mesenchymal. I'll have to Google it so I've got the right spelling in my notes. Yeah. But yeah, so that it sounds like that is, well, from all of what you were just explaining, that's not, well, it's not manipulating. It's not manipulating the tissue or the cell.
Right.
So it's different.
When the cells are obtained without the use of chemicals or enzymes, and they were not grown to huge numbers, then they're considered minimally manipulated.
Yeah. Okay. And that's what you're doing, and that's what you're saying, that there's certainly a growing demand from patients for that, at least at that level at this point. Yeah. Okay.
I don't know how long
you may not, but do you know?
Do I know what?
So I was just going to say, do you know if any of it's available in Australia? I mean, I can try to research it, but do you know of any doctors doing it here in Australia?
I do have Australians wanting to come and to do the treatment here because they couldn't find it in Australia. I think it's interestingly, your country is fairly conservative.
Oh yeah,
medically, yeah.
Yep. Yeah, that would be a fair assessment, I would think. I mean, obviously, I'm not a doctor, but my observation from talking to lots of medical people here, I think that's probably a fair assessment. So we might be a little bit, Australian listeners, we might be a little bit further down the track, but I think it's still helpful to know what's coming, and what is available other places, because it is probably only a matter of time.
It is a matter of time.
So, and if people wanted to connect with you, and obviously, if they wanted to have a consultation with you, or have some stem cell therapy and can get to LA, or how do people work with you? How should people connect? How do we learn more? How do we get more of you and your knowledge? And
so I do have my YouTube channel. I think people will find it very helpful. So just on YouTube, look for Joy Kong MD. You will see a lot of different videos where I explain various aspects about stem cell therapy, like the 3 stages of healing of stem cell therapy, and what about other people's DNA in our body? How do we look at that. What about stem cells versus exosomes? What about what they're doing in Panama? Is that better? So I go into much more detail of what, just the common questions that people actually ask, people who are looking for therapy, that they have these questions. So that's very helpful. And my clinic is called Uplift Longevity Center. So it's Uplift with a Y. So just, the website is upliftcenter.com. And then, so those are two good places to find me.
Excellent. Yeah, and I've watched a couple of your, YouTube videos, and it's just really interesting. Yeah, it's interesting, and I think you explain things really clearly. And so, yeah, definitely, if this interests you, then check out Joy's YouTube channel, and just learn. I think knowledge is power. The more we understand, and even if you're listening to this and you think, stem cell therapy is just not within my reach or radar or whatever, just even understanding what you said about the importance of reducing inflammation and cellular health, like they're all principles that apply to anybody, but to this audience, because that's my whole approach to managing my thyroid health is about reducing inflammation. So taking out inflammatory foods and reducing stress, and a lot of the supplements and essential oils and all sorts of things that I do is all about reducing inflammation. So even if you take away that from this conversation, it just reinforces.
I'll leave the audience with this. I do think one day stem cell therapy is just going to be part of everyday medicine. Is going to be as commonplace as antibiotics, because you're going to do regular stem cell therapy. Now we know they're there. Okay, cat has been out of the bag, so we know all these tissues. We got stem cells. When you put stem cells in you can rejuvenate and repair. Now we know, so you can't unknow something. So once we know, what we can do is that if you get sick, you can get some stem cells. You can trigger this whole mechanism of repair. And then if you're not sick and you just want to stay well and stay young, you can use it as a regular preventative measure to keep your good health, because it has this whole rejuvenating effect. If you are getting rid of bad cells and rejuvenating with good cells, and you have these protective, even DNA, rejuvenating effect, because there are things that stem cells can send. The microRNA can change methylation patterns and can help the cell DNA to repair to a certain extent. So you're repairing the body on a regular basis, as a preventative measure. And so if someone needs to do a surgery, instead of taking antibiotics, you can still take it, but you can do a stem cells. Probably really is going to help protect your body, help you recover much faster, which I've already done. Before surgery or right after surgery, you do stem cell treatment, people recover 2 to 3 times as fast. And then, more beautifully, right? Instead of big scars, then you don't have, barely any scars. So it's just going to be part of, it's like, okay, you're going to get an operation. All right, let's do some stem cells, prophylactic stem cells. That's the future.
Wow. Well, that's a really hopeful, positive way to end the conversation. Let's look forward to the future. I think the future in medicine is really interesting and personalized and fresh. So, thank you for your time and your knowledge, and just spreading that message, I guess. And a lot of what this show is about is just spreading awareness and information and helping people, live better, feel better, so I really appreciate your time today.
You're very welcome. Yeah, I enjoyed talking with you.
Thank you so much for watching this episode of Let's Talk Thyroid. I would love it if you enjoyed it, if you would hit subscribe and the bell. That would be really helpful. Even more helpful, actually, would be to share it with someone else who has thyroid issues or you think would benefit from listening. That really is part of my mission, I suppose, is to spread the message of positive and practical approach to managing your thyroid health so that people really kind of have more energy to get on with living their life and not just kind of trudging through each day. So spreading that word really genuinely helps other people feel better, live better, be better. The best way that you can connect with me is through my website, which is annabellebateman.com. From there, really, you'll be able to connect in all the other ways. I would love it if you would join my Facebook community group. There's lots of great support there. It's all free. That's just being with like-minded people. But from the website, you can also book a strategy session with me. So if you're feeling a bit overwhelmed, not too sure where to start, then book a strategy session. There's also freebies to download and links to look at my online courses or purchase some essential oils or my cookbook. So that's really the hub, would be annabellebateman.com. But look forward to connecting with you and just being in this thyroid health journey together. Have a great day. Bye.
The information presented and discussed in this podcast is not intended to diagnose, treat, cure, or prevent any disease and should not be used as a substitute for proper advice from a qualified professional.